So in this news report on February 7th, 2021, United Biomedical in their press conference claims that they can release 20 to 30 million doses of their vaccine by July this year. However, at this time, they had not finished phase 2 testing and had no plans to even start phase 3 testing yet. How could they know in July of this year that they could release 20 to 30 million doses? With no way of making their timeline, Tsai Ing-wen was making no attempt to order vaccines from the US at quantities that could actually protect the Taiwan public.
今年我们预计可以做到1亿剂，在6月到7月中间会有2000万到3000万剂。
Soon after this, however, the excuses started coming from the Tsai administration that there was interference from mainland China, and that's why they couldn't order BNT or Pfizer. But as we can see from this news report we just saw, they had every intention of promoting their own domestic vaccines in the Taiwan market.
A deal for Taiwan to purchase Germany's BioNTech COVID-19 vaccine has been called off. The island's health ministry says that outside intervention may have jeopardized the deal, citing potential pressure from China.
其实那时候我们新闻稿都准备好了。
本来中国本来那个 BNT 的500万剂都已经准备好要来了，
都准备好，
中间确实生变了。
然后最后大概讲出来，然后大家有人就不希望台湾太高兴嘛。
He suspected that political factors played a role in the company's cancellation. BioNTech cited challenges about the global distribution of coronavirus vaccine and internal disagreements among company leaders as reasons for the cancellation. Now, there is growing speculation that the pressure comes from China, but the minister has declined to confirm.
So we can see the health minister is claiming that they nearly ordered 5 million doses of BNT. However, is this really true? He provides no evidence for this order being placed or that it was actually cancelled last minute. It's just a story. But remember, we already got the truth a few months ago from former Premier Lin Chuan, who said very clearly in his press conference that the government would not even authorize a purchase of over 2 million doses. So where is this 5 million coming from?
The first batch of 200,000 doses of AstraZeneca's COVID-19 vaccine will arrive in Taiwan this week. Frontline medical personnel will be prioritized to get their jabs in March at the earliest. However, there have been reports of side effects, including headaches and fever in some European countries after medical workers received the AstraZeneca vaccine. Parts of Sweden have already temporarily suspended use of the drug, and France is not recommending it for the elderly. Here in Taiwan, medical experts have weighed in on the situation.
So in a nutshell, the Tsai administration basically downplayed the potential side effects of AstraZeneca, despite the fact that several European countries were voicing concerns about it or had stopped using it. We can see that people who defend the Tsai administration also defend the use of AstraZeneca as if they were defending Tsai Ing-wen because she's so hell-bent on using AstraZeneca in the Taiwan market for some reason.
So I know you've been looking into the numbers, right?
Yeah, that's right. So there's a simple answer to the question of how many vaccines does Taiwan have, and that is none so far.
Oh, no.
Yeah,
no.
But there's a bit more to it than that. So the government has bought 10 million doses of the AstraZeneca vaccine directly from AstraZeneca. They've also bought 5 million from the US company Moderna, and they're getting 5 million more from COVAX. So that's 20 million vaccines in total.
As of August 2021, we still haven't seen much of these doses that were supposedly ordered. Most of the vaccines in Taiwan have been donated, and Moderna is in very short supply.
So I'm curious to know, and call me selfish, but when am I going to get a vaccine?
Sure, well, there's a lot of uncertainty about that. We're not really sure about delivery times for a lot of the vaccines. The one thing we can say for sure is that there should be 200,000 doses of the AstraZeneca vaccine coming via COVAX to Taiwan in the coming days. So that's going to be very, very soon. But the rest, well, we just don't know for sure.
And I know that Taiwan is also developing its own vaccines. Tell us about that.
Yeah, that's right. So Taiwan is developing vaccines at the moment through 2 companies who are leading the way. They're in phase 2 trials at the moment, and those trials are expected to end around June. And hopefully then, once those trials are over, they can report the results and get emergency authorization to start producing them in July. And the government is hoping to buy 5 million doses from each of those companies.
Taiwan Insider on RTI is a government-backed show for the Tsai administration. We can see here that there was never any plan for the two domestic vaccine companies to go through phase 3 testing. They had started phase 2 testing by February and expected to finish in June, and basically planned to go on the market in July or August. This is not only irresponsible, but it's also potentially dangerous for the Tsai administration to be promoting domestic vaccines without doing phase 3 trials.
Hopefully, if things go to plan and we get 5 million more from the Pfizer-BioNTech deal, and then hopefully another 10 million from domestic manufacturers, that could add up to 45 million doses for Taiwan.
Ooh, that's pretty good.
45 million, so
Yeah.
that's
That should be enough
close,
for you
right?
to get
And
vaccinated.
Yeah, that should be enough for everyone in the country, hopefully.
Well, as of August 2021, I can assure you that there aren't 30 to 45 million doses of any type of vaccine in Taiwan. So this article dated February 27th, 2021 reads, Johnson & Johnson COVID-19 vaccine authorized by US FDA for emergency use. Here it reads, this decision was based on the totality of scientific evidence, including data from phase 3 ensemble study that demonstrated the vaccine was 85% effective in preventing severe disease across all regions studied, and showed protection against COVID-19 related hospitalization and death beginning 28 days after vaccination. So there's a couple of points I'd like to make about the Johnson & Johnson vaccine. First of all, this is a one-shot vaccine. Secondly, it's an easier vaccine to store than BNT. In my opinion, this is a much easier vaccine for the Taiwan market because it's only one shot and would have been very easy to distribute among the Taiwan public. However, till this day, there has been no attempt to order Johnson & Johnson for the Taiwan market. All the news is directed at Moderna and BNT/Pfizer, as well as AstraZeneca. There is also no way that mainland China could possibly interfere in the ordering of Johnson & Johnson. I believe that Johnson & Johnson should be an option in Taiwan, but it isn't an option. Perhaps one reason why the Tsai administration was never interested in ordering it was because it's a one-shot vaccine. They appeared to only want two-shot vaccines for some reason. There's also some concern about the mRNA vaccines. Not everybody wants an mRNA vaccine. AstraZeneca and Johnson & Johnson are both viral vector vaccines. I believe that Johnson & Johnson should be another option as a viral vector vaccine in Taiwan, but for some reason Tsai only likes AstraZeneca despite the number of negative reports regarding it.
Taiwan has received its first AstraZeneca vaccines as it prepares to begin its immunization campaign. The 117,000 doses are part of 10 million secured by the island.
Health authorities say the first group of people who will receive the shots are the medical staff. Currently, there are some 310,000 medical staff that have the priority. So no government officials, including President Tsai Ing-wen, will receive the first shot.
AZ 的疫苗那总共是11.7万剂，11万7千万剂那上午11点21分，由韩国大韩航空的班机那抵达桃园机场。这是 AZ 跟我们签约里面所要提供的一部分，不是 COVAX 的。
So the first issue is, why did only 117,000 doses arrive in Taiwan? Why such a small number? Was that all that was available? Or did Tsai deliberately keep the number low? The second issue is, why didn't Tsai take AstraZeneca herself? Later on, we will see that she claims she signed up for the domestic vaccine, Medigen. However, it was also reported that she secretly took the BNT vaccine already.
South Korea's mass immunization campaign is picking up pace amid safety concerns. While no direct link is found, 3 more post-vaccination deaths reported, all of them from AstraZeneca's.
3 more AstraZeneca vaccine recipients died on Thursday. 2 were in their 50s and 1 was in their 20s. Both of those in their 50s were patients at nursing hospitals in Jeollabuk-do province and had underlying conditions, cardiovascular disease and diabetes. While the first patient died 2 days after getting the shot, the second person died just 1 day after. The person in their 20s who suffered from epilepsy died at a nursing hospital in the city of Daejeon. 515 new cases of AstraZeneca vaccine side effects were filed on Thursday, raising the total to 722.
For British drug maker AstraZeneca, its COVID vaccine is being halted for use in several European countries. This coming days before the drug maker is set to make its case here in the United States.
While AstraZeneca is getting ready to ask the FDA to add its vaccine to our COVID arsenal, nearly a dozen countries temporarily stopped using it, citing concerns over blood clots. As of now, there's no clear evidence that those blood clots are directly related to the vaccine. but an investigation is underway.
Germany is the latest to join a growing number of countries to suspend the rollout of the AstraZeneca COVID-19 vaccine over safety fears. Bulgaria, Denmark, Ireland, the Netherlands, Norway, and Iceland have stopped giving the shot following reports of an increased risk of blood clots. But AstraZeneca and the World Health Organization insist there's no risk. The move comes after a leading German lawmaker called on the authorities to issue clear guidance on whether the vaccine is, quote, good or bad.
The health minister says Taiwan still plans to use AstraZeneca's COVID vaccines, even as Europe closes ranks against the formula. This week, Germany, France, and Spain announced a halt to the shots amid reports of a blood clot risk after inoculation.
Altogether, there are now more than 15 countries that have called a halt to the vaccine, though the World Health Organization says there is no clear link between the vaccine and blood clots. Health Minister Chen Shizhong said Tuesday that the evidence still shows that the vaccine is safe and that there are no plans to delay administration.
Basically, at this time, we believe that the vaccine is safe. Recently, several countries have suspended administration, but that will have no impact on our timeline.
By this time, it was already obvious that many nations were having issues with the AstraZeneca vaccine. However, the Taiwan administration showed no concern over the safety of this vaccine. They could have easily changed course and started ordering Johnson & Johnson, but they insisted on this vaccine. The question is, why did they do this? Why does Tsai insist on people using AstraZeneca in Taiwan?
Taiwan has begun its vaccination drive, with officials getting the AstraZeneca shot to boost public confidence. The island has been held up as a model in containing the coronavirus, with just over 1,000 cases. But it's struggled to obtain enough supplies of vaccines.
Many Taiwanese are not exactly in a rush to get vaccinated. According to a recent survey, 40% of Taiwanese do not want to be vaccinated with AstraZeneca because of the safety concern. So Premier Su Zhenchang and Health Minister Chen Shizhong, they took the lead to get the first shot to reassure the public that the vaccine is safe.
我刚才已经完成注射，打在左边的手背上，现在打针的地方并没有任何疼痛的感觉，身体也没有任何酸痛的感觉，让大家看到我的状况，也可以安心。政府进口的疫苗一定经过安全检查后，一定来保护第一线的医务人员。
I have my doubts if Premier Su Zhenchang really got the AstraZeneca vaccine as he claims there in the video, because if you were in his position, wouldn't you wait for a better vaccine?
According to Health Minister Chen Shizhong, he has been told by the suppliers that there is a huge demand for vaccines around the world, and they have to prioritize, and they have to give priorities to those countries that are worst hit by the pandemic. Now, in comparison, Taiwan has a relatively low infection rate and death rate. So that is why Taiwan is being put on the back of the list.
If Health Minister Chen Shizhong expects us to believe something like that, he needs to provide evidence that other nations were first in line to get AstraZeneca over Taiwan. Otherwise, it sounds like just another excuse for why so few vaccines were brought into Taiwan at this time. It looks like they were just protecting the market for their domestic vaccines.
More concerning news about the AstraZeneca vaccine tonight. Provinces have been advised to stop using it for people younger than 55 until more reports of blood clots in Europe are looked into. This is the third time in a month guidance on this vaccine has changed. We'll get more information from the head of the Immunization Advisory Panel, which is making the recommendation. I think it's not just anti-vaxxers right now. It's a lot of average Canadians who are getting an inundation of various recommendations. You know, first, not for older people because there wasn't enough data. And I know there's reasons behind it, but then this pause and might be feeling like I'm just going to hedge my bets and wait until I can get a different vaccine. Would you yourself take AstraZeneca, and what would you say to those individuals in this country right now?
Yeah, and I fully understand. I mean, seriously, when you look back on the history of this AstraZeneca vaccine, we all say, I don't know what happened, but it was born under not a good star.
Tonight, Germany is halting the use of AstraZeneca's coronavirus vaccine for people under 60 and says it will now only administer the vaccine to people 60 and older. The sudden decision was announced after Chancellor Angela Merkel and the country's health minister convened an emergency meeting earlier today, and it comes amid fresh concerns over unusual blood clots reported in a tiny number of those who received the vaccine. There have been 31 cases of cerebral thrombosis here in Germany that reportedly occurred after the AstraZeneca vaccine was administered. 9 of those cases resulted in death.
Now, Denmark happens to be the first nation in Europe to suspend the use of AstraZeneca jab in its vaccination rollout after reports of rare but serious cases of blood clotting were amongst those who had received the vaccine.
There's been a lot of news about the AstraZeneca vaccine lately due to recent trials and blood clot cases, and we're going to try to make sense of that for you today. Vaxzevria is one of the names of the AstraZeneca vaccine. On March 25th, the company released results of a U.S. trial of over 32,000 people that found it was 76% effective in preventing symptomatic COVID-19 and even more effective for older people.
And it was 100% effective in preventing severe cases and hospitalization.
Now, who is using the AstraZeneca vaccine?
More than 115 countries are using it. 25 million people have been vaccinated with it in Europe. But there has been some cause for concern.
Yes, this month the European Medicines Agency said that a rare side effect that should be listed is unusual blood clots with low blood platelets.
But they say the benefits of vaccination outweigh the small risk. Nevertheless, the agency recommends that people under 30 get a different vaccine if one is available.
And the reason for concern is that in Europe, there were 18 fatalities from these unusual blood clots.
Most of the cases were women under 60. No common underlying condition has been identified. So all of this leads up to the question, should we get the AstraZeneca vaccine?
Yeah, that's right. And I think it's a personal choice. You have to weigh the risks and the options. And I think people in Taiwan, because there's not a big risk of COVID, have been a little bit hesitant.
Yes, I see that.
Because we are not in danger of getting COVID. There's not much domestic transmission going around.
Unfortunately, AstraZeneca was in fact the only option in Taiwan at this time. So much for the 20 million doses that were supposed to arrive by March 2021. And as we'll see soon, the number of domestic transmissions increased dramatically in May 2021. This also increased the demand for vaccines in Taiwan,